Well, this morning on Lloyd Allen spoke with Deputy Chief Medical Officer Dr. DeLon Brennan, who first addressed the whole issue of mass testing.
Most of the tests that we've done so far are definitely a closed environment, but we haven't done the prison yet. That is actually happening on Thursday, so we have that planned. These are tests that have been organized with some of the persons who've returned to the Bahamas through our repatriation exercise. Others have been healthcare workers that may have been exposed. So it's a number of vulnerable populations, but also targeted in other areas.
Much of the flu symptoms are very much similar. We talked about this before to COVID-19. And again, what do people need to know to help them to delineate between the two?
Unfortunately, it's not really going to be, none of us are really going to be able to differentiate without testing whether your symptoms are due to influenza or are they due to COVID. So if someone does have symptoms that could suggest either the fever, the body aches, the cough, or difficulty breathing, then our suggestion is to give a call to your healthcare provider. And if the decision is made that testing needs to be done, then we would have you present to one of our COVID centers where we'd be able to do the testing either for influenza, COVID, or both.
And over the past few weeks, we've heard health officials talk about the flattening of the curve. Now, with the numbers in recent days looking as positive as they have, and using the government schedule for the reopening of the economy in phases, give us an idea of what conditions would provide an easy transition to the next step.
I think what we're seeing now is a continued decline in the number of daily cases that we have had. We have not just looked at it on a daily basis, but we actually look at it in weeks as well. And so if you have an opportunity to look at it in weeks, the number of cases is starting to decline when you consider from one week to the other the total number of cases for the weeks. And so that is a positive sign that we are seeing a flattening of our overall numbers from one week to the other as well. And that gives us some encouragement that we can recommend to the policymakers that the decrease in the restrictions is still able to progress in the way it's progressing now.